Dr. Humam Kakish came to UT Southwestern in Dallas from Stanford over a decade ago. This vascular surgeon explains his chosen profession this way.
What I tell my patients that when they say, "What do you do?" I say, "I'm a plumber." What does that mean? Well, we fix pipes. If the pipe is not working properly, either it's enlarged or blocked, then we fix it. And it depends where the pipe is. That's what dictates what kind of treatment we do. So if the blood vessel is enlarged, it's called an aneurysm. If the blood vessel is blocked or gradually gets smaller in size, that goes into the peripheral arterial disease.
Dr. Kakish says peripheral arterial disease tends to affect those 65 and over, 50 and over with a family history. But the younger population has other risks.
The younger population, they will develop vascular disease in the veins rather than the arteries. And that's where varicose veins comes in and plays a big role there. There's not a single woman that I'm aware of here that doesn't have either one form or another of a vein that shows on the legs, either a spider vein or a big varicose vein or the more advanced skin damage and ulceration. Varicose vein is definitely more common in women. Genetic history is very strong. So if mom or grandma or aunt or grandfather has varicose veins, there's a good chance you can develop varicose veins, especially if you've had children. What we need to understand though, vein disease is not dangerous, don't worry about it, it's just cosmetic. That is not the case. What we've learned over the past few years is that it will continue to worsen. Ignoring it is not an option. But you can prevent it by making sure you wear compression stockings, especially if you stand on your feet and legs all day long. And if you do wear compression stockings, specifically during pregnancy, then you limit the damage to the veins.
So what treatments are available?
You go in for a complete evaluation, which includes a physical examination and an ultrasound to look at these veins to decide which one of these multiple veins we have in the legs is not working properly. It depends on which one of these veins is not working properly. We'll decide what kind of treatment there is. In the past, we used to do what's called vein stripping. Very painful. Luckily, things over the past probably 7 to 8 years have changed. Newer technologies are in. What we do is, instead of removing the vein, we shut it down and leave it where it is. So you accomplish the end result without the damage. What are the new technologies? Radiofrequency and or laser. So the technology in this is you actually put a catheter inside the vein by making a small needle puncture inside the vein and putting this catheter in. And when you get to the proper place that you want to start closing the vein, that's when you add either the radiofrequency or the laser. Most of these procedures can be done in an office setting under local anesthetic, and you can resume normal activity the very same day.
Okay, what are spider veins?
If you look at anybody's legs, you're going to find these hair-like colored either red or purple veins on the skin, just under the surface of the skin. These are spider veins. They don't cause harm, but they're unsightly. How do we treat them? By doing what's called sclerotherapy. Sclerotherapy is injection of a solution inside these veins to cause a local inflammation. The local inflammation will push away the blood out of the veins and shut the small vein down that you don't see it anymore. It is not painful. The session lasts about half an hour and it's about 25 to 30 injections.